All right. Hi. So today I am going to be doing a focused assessment relating to cardiac. So this is our patient. This is Minnie. She's going to be with me for all of my assessments today. All right. So I walk into the room. I'm completing hand hygiene, taking hand sanitizer, sanitizing my hands, and then I'm putting on clean gloves. Hi, Minnie. My name is Erin. I'm going to be your nurse today. I just want to check your name and date of birth. Okay. Can you tell me your name and date of birth? Thank you. So I'm just going to be doing a cardiac assessment. I'm just going to listen to your heart sounds today and just inspect your pulses. And I just want to check to make sure that you don't have any swelling. So her bed is a pillow. But I want to make sure that the bed's locked. She has her call bell within reach. Her equipment is working. So that would be her oxygen and then her suction behind her. And also, too, I want to make sure that I'm giving her privacy as well, where I'm closing the curtain around me. And then I want to elevate the bed to a workable position so that I am able to assess the patient. Along with that, I also want to ask the patient, are you experiencing any pain today? Can you rate it on a scale of 0 to 10, 10 being the worst pain that you could ever imagine in your life and 0 being no pain at all? Okay, now I'm ready to start with my assessment. So let me just get my stethoscope in and we're going to get rolling. Sorry, the patient doesn't have a good support behind her, but in the real world they would, because they would be sitting in a bed. All right, so first I am going to listen to her heart sounds. So I'm going to listen with the diaphragm first, and then I'm going to listen with the bell second. So first I'm going to go for her aortic. Okay, then I'm going to go to pulmonic, and then Erb's point, tricuspid, and then the mitral, or the apical. So for this one, I have to listen for a full minute. I'm going to start right now. Okay. Now I'm going to listen to her heart sounds with the bell. So once again, aortic, pulmonic, Erb's, tricuspid, and then the mitral, which we would do that one for a minute, mitral apical as well. Okay. So since we're done listening to the heart sounds, I'm now going to assess the patient. First, I'm going to start out with her carotid. So for this one, I'm going to feel on one side because I don't want to use both of my hands and feel at the same time. I'm just listening for any bruise. Don't feel one. And I don't feel one. Next, I'm going to assess for edema. So this is just pressing on the patient. Looks like Minnie's good. She doesn't have any edema. No edema. And then I'm going to assess her pulses. So I'm going to start off brachial, which is right here, radial, popliteal. So I would do brachial, sorry, brachial, radial, the femoral, which is right here, popliteal, posterior tibia, and then the dorsal pedis. All right, Minnie, so you have all your pulses, your heart sounds. They sound great, and you don't have any edema. Do you have any questions for me? No? Okay. So I'm going to take off my gloves, and I'm going to perform hand hygiene. And then also I'm going to lower the bed back down to a low position, make sure the wheels are locked, check her equipment once again, make sure that she has her call bell within reach. You know, I'm going to ask what preference she has for privacy. And that's it. Thank you.